But the problem is the economy. The problem isn't people on Medicaid. The problem is that we've outsourced all our good-paying jobs to China and other places with slave labor so that the people at the top can make more money. So they're they're going to try and cut Medicaid, right? And
Finally.
So now I told you that half the countries gets their health care from the government. About 80 million people get Medicare. That's actually not from the government. They paid into it their whole life. And then 70 million people get Medicaid, right? So that's like half the country. And now they're trying to cut that. So they didn't cut any money from the Pentagon. So Doge was all the smokescreen because all the money that they cut or saved you, first of all, they didn't even vote on it. Second of all that money that Doge supposedly saved you, Trump has given right back to the war machine, which is where that money came from in the first place.
The same machine that stole 23 trillion.
The same machine that stole 21 trillion from you. So now House Republicans push forward a plan to cut taxes, Medicaid, and food aid. So but the big story is that a lot of Republicans are against this. Why? Because they know a lot of MAGA people rely on Medicaid. And here's Josh Hawley. There's no bigger conservative than Josh Hawley, I would say. He's certainly hawkish on a lot of things. He's very right-wing. And here's what he has to say about it.
Medicaid. Do you agree with the speaker? Is this bill not a cut to Medicaid?
Well, the right thing to do is not to cut Medicaid, so I'm glad to hear him say that. Manu, it ought to be just a basic foundational principle. It is wrong to cut health care for the working poor. And that's what we're talking about here with Medicaid. My state is a Medicaid expansion state. Over 20% of Missourians, including hundreds of thousands of children, are on Medicaid. And Manu, they're not on Medicaid because they want to be. They're on Medicaid because they cannot afford health insurance in the private market. These are working people and their children who need health care. And it's just wrong to go and cut their health care when they're trying to make ends meet, trying to help their kids, trying to make sure that they're able to provide for their families. So I hope that the House GOP and the Senate GOP will get the message here. By the way, President Trump has said the same thing. No Medicaid benefit cuts.
Well, he said it, but now they're trying to do it. So good for Josh Hawley for saying that and reminding people that a lot of the people on Medicaid are working, the working poor who can't afford it. So they're working. And so what big part of it, they're trying to put work requirements into Medicaid, which is dumb for a lot of reasons because a lot of the people are already working. And second of all, you go on Medicaid when you lose your job. So a lot of people have to go on Medicaid because they just lost their job. And there's myriad other reasons why that's dumb to put work requirements in there. It sounds good. It makes people feel good. Oh, yeah, again, it's just a dumb idea that we don't have universal health care for anybody. Here's Steve Bannon. It's got Kurt, what? I'm sorry, Kurt.
Money.
What?
Oh.
Say it again.
It's better that we half-ass it. So half the people do have it, and the other people pay too much for it.
That's right.
And then nobody gets the proper service. That's our amazing.
That's our amazing. So here's Steve Bannon, and here's what he says
we
about
just can't
cutting
go in with a
Medicaid.
meat axe and cut Medicaid.
You just can't go to a meat axe and cut Medicaid. Why?
We just can't go in with a meat axe and cut Medicaid. You got to be very smart about this. Why? As I've been saying for a long time, just look at it. There's a ton of MAGA, of working class folks, Hispanic, black, and whites, that are on Medicaid, that are working, not sitting there gaming the system, not asking for a handout. Why? Because the jobs don't pay enough.
But the problem is the economy. The problem isn't people on Medicaid. The problem is that we've outsourced all our good-paying jobs to China and other places with slave labor so that the people at the top can make more money. Now, China made a lot of money off us doing that, too. Guess what China did with their money? They invested the money they made off that deal by producing our goods at cheap. They took that money and invested it into high-speed trains, into school, into healthcare, into infrastructure. Their cities are beautiful. We didn't. We put it in the pockets of Jeff Bezos and Bill Gates and people like that. So there's two right-wingers. So again, this isn't lefty Jimmy Dore. And here he talks about how Trump said he's against it. Here's Trump saying that he's against it. Let's watch.
President spend spending bill that passed last night aims to cut $2 trillion.
Right.
Can you guarantee that Medicare, Medicaid, Social Security will not be touched?
Yeah, I mean, I have said it so many times, you shouldn't be asking me that question. Okay? This will not be read my lips. There won't be read my lips anymore. We're not going to touch it.
So he's talking about George Herbert Walker Bush, who said, read my lips, no new taxes. And then he gave us new taxes. So that's a big part of why he didn't get reelected. And Trump is saying, this isn't, no, you don't have to read my lips. We're not going to touch it. So, but his Republican lawmakers are trying to do that, just that.
Does Trump know it's even in there? Does Trump even know it's in there? Because I watched another guy lie to him about that Supreme Court decision and tell him the exact opposite of what the decision was on camera.
We saw him. I know. We'll see. So just to let you know, this measure, they're putting this in so Trump's still going to extend his 2017 tax cuts. So this makes up for that budget shortfall, some of it. The measure would extend Mr. Trump's 2017 tax cut and temporarily enact his campaign pledges not to tax tips or overtime pay. Cuts to Medicaid, food stamps, and subsidies for clean energy would partly offset the roughly $3.8 trillion cost of those tax measures. I'm all for them cutting the subsidies for clean energy. I'm all for that.
Yeah.
Because as Michael Moore's movie proved, that it's counterproductive. That you create a bigger carbon footprint just trying to get clean energy. So until they figure that out, I'm against the subsidies for it. This is taking money from the poor and the working poor and giving it to the rich because that's what the tax cut's for. So that's what this is about. Okay. So guess what? The nonpartisan Congressional Budget Office said that at least 7.6 million fewer people, at least. So that means probably more than 7.5 million people are going to lose their health insurance with this. Now, if you listen to the people in favor of this that want to cut it, they say, oh, we're just going to cut out the illegal aliens who are on Medicaid. That's only 1 million people. So this is 7.5. And Josh Hawley and Steve Bannon just told you it's not illegal aliens. A lot of MAGA who are workers can't afford health care.
And I'm not confident in your ability to discern the difference between illegal aliens and not illegal aliens based on, how they handle the illegal aliens.
Right. The CBO also gave lawmakers, so the nonpartisan CBO also gave lawmakers a preliminary analysis showing that 3 million fewer people each month would participate in SNAP, which is food stamps. So poor people were taking away their food and were taking away their health care. So we could do what? So we could extend his 2017 tax cuts for rich people. The majority of those tax cuts went to the upper 20% of income earners, just so you know.
What if we didn't make the military budget $1 trillion?
And they're not cutting any.
That?
And they're not only are they not cutting from the military, Donald Trump is proposing we spend all the money that Doge saved, we give it just right back to the war machine. So
why didn't Doge hit up the Pentagon?
They didn't go to the Pentagon. They didn't do that. And I showed you before, Steve Bannon said they have to go cut the Pentagon. And if they don't do that, then they're not serious. And they're not serious. Doge was never serious. And that's the bad news about Doge.
I take it as Trump don't have the power to cut the Pentagon.
I was rooting.
He literally does not have the power to do it.
He does. He has the power to not propose more money for them.
I would think.
So this is what happened on Wednesday. House Republicans pushed forward a major legislation to deliver President Trump's domestic agenda, moving over the opposition of Democrats to advance tax cuts, Medicaid, and food assistance after slogging through all night in an all-day draft. The votes in 3 committees were a crucial step for Mr. Trump has labeled the big, beautiful bill. So he's behind this. Trump is behind this. He calls it a big, beautiful bill. Hey, how about we just do a medium-sized so-so bill? How about that? And that Republicans hope to push through the House by the end of next week. Even as the committee approved the slices in their plan and on party line votes, House Republican leaders face dissent from who? Republicans. Republicans from high-tax states like New York were furious about a provision that would increase the limit on the state and local tax deductions to $30,000 from a $10,000 cap they regard as far too low and which is still being negotiated. The plan is also facing Republican opposition in the Senate. I showed you Josh Hawley is one of them. Senators Rand Paul is another. Ron Johnson is another. They say the current bill is fiscally irresponsible. Susan Collins of Maine, she opposes at least one Medicaid provision in the legislation. And there's Senator Josh Hawley of Missouri described the bill's changes to the government health program for the poor as a non-starter, saying they amounted to taxing the poor to give to the rich. This is opposite of what Trump said he was going to do. This is real Medicaid benefit cuts, Josh Hawley said in an interview. I can't support it. No Republican should support that. We're the party of the working class. We need to act like it. Okay?
That's what Bannon said.
That's what Bannon said. Republicans are using a process known as budget reconciliation to shield the measure from a filibuster. So they're going to try and make it filibuster proof. And that they're going to push it through Congress with a simple majority. With all Democrats opposed to it, they can only afford to lose 3 votes in the House and 3 votes in the Senate. So almost all the Republicans have to vote for this for it to pass. Democrats have aimed most of their criticism at the bill's health care provisions, which they believe will be politically damaging to Republicans who back them. Believe me, it will. Steve Bannon already told you it will. Josh Hawley already told you it will. More than 8 million Americans are estimated to lose insurance coverage if the bill comes law. The Agricultural Committee, which took a break from debate on Tuesday night and reconvened for nearly 12 hours on Wednesday, approved major cuts to food assistance programs through increased work requirements by shifting some of the program's costs to the states from the federal government. Democrats repeatedly bashed the Republican proposal as a scheme to take basic necessities from children and families in order to cut taxes for wealthy Americans and corporations. That's what it is. The Energy and Commerce Committee, whose portion of the bill includes major funding cuts and policy changes to Medicaid, plowed ahead through Tuesday night and into Wednesday afternoon before approving its part of the package. The Congressional Budget Office has estimated that the committee's proposed changes, which are concentrated on health care, would save more than $900 billion over the next 10 years. So you could just cut a couple of $100 billion off the Pentagon and get the same savings. But no, they're going to cut it off working people's health care. Much of the discussion centered on work requirements, and I'm going to tell you why they're stupid. Most people are working. Another thing is a lot of people have to go on Medicaid when they lose their job. The policy, which will begin in 2029, is expected to push millions of Americans off the program and achieve significant spending reductions. Under the position, Medicaid beneficiaries would need to submit paperwork every month that they worked at least 80 hours or qualified for an exemption. So do you see what this means? So they're going to spend more money on bureaucracy and paperwork every month. So that's where the money. And they're going to spend more money on bureaucracy. This is a bad idea. This whole bill is a bad idea.
Let's look at from a conservative perspective. Why should a private business have to pay for your health care for working there? That seems like an unjust socialist thing to impose that on the employer.
Right?
Shouldn't your government you pay taxes to, presumably for some kind of service, do that for you? Shouldn't they?
Democrats assailed the provisions, arguing that its complex reporting rules would cause eligible people to lose health coverage. Republican committee aides were asked to answer detailed questions about what would happen if a person failed to file required paperwork while hospitalized. So you're in the hospital and you can't file the paperwork. They just get rid of your Medicaid.
You know, this is so outrageous to me. I just keep thinking, I'm like, well, let's first start cutting Congress's health care. Let's cut all of theirs.
That's right.
Yeah, they don't get Obamacare, by the way.
They get the best health care.
They get a special health care, the Congress people. Many of the details of the work requirement were modeled on a program in Georgia that has resulted in lower enrollment and higher administrative costs. So they have a version of this plan already in place in Georgia, and what did it resulted in? Working people losing their health care and higher administrative costs. That's what I just said, because they have to every month submit this paperwork. Studies suggest that most Medicaid beneficiaries who would be subjected to the new work rules already work. They're already working. So now we're going to spend way more money on paperwork and bureaucracy and administrative costs to make sure the people already working are already working. And nevertheless, those work requirements cause those people who are already working to lose their health care. Representative Brett Guthrie, a Kentucky Republican who chairs the Energy and Commerce Committee, said Republicans have crafted this bill carefully to avoid the issues. Okay, yank. We absolutely don't want people to qualify for Medicaid to not receive Medicaid because of red tape, particularly when they're trying to work. They are working. They're not trying, they're working. Debate also focused on a new co-payment requirement for some Medicaid patients to go to the doctor, a change that some Democrats characterize as a sick tax that would prevent low-income people from seeking care. GOP Medicaid cuts are so this is the numbers are clear. Nursing home recipients depend on Medicaid. How many of them? 63% of nursing home care in the United States is funded by Medicaid. So you're going to do is pull the plug on those people? Some states are even more dependent on Medicaid than the national average. For example, West Virginia, 77% of nursing home care is funded by Medicaid. So this is our society, our country, taking care of elderly, sick people. And if you don't do that, you're not a country. You're more of a what's the word I'm looking for? I can't think of it. Political reported on the morning of May 15th that after a marathon markup session lasting 26 hours, the House Energy and Commerce Committee advanced legislation that would slash Medicaid spending by hundreds of billions of dollars. These cuts would directly impact nursing home residents and their families. So you're going to have to pay more for your parents who are in nursing homes. Working people are going to have to pay more. What is this for? This is so we can give more money to the Pentagon that nobody wants to do, no American citizens voted for. And this is so they could give a tax cut to the richest 20% of Americans. The nursing home residents' coverage will be at risk. Either the home itself will have to either people will have to make up for that loss in some way, or they will simply have to say, we can no longer support people on Medicaid and kick them out. And then it falls on families. While the Medicaid cuts would hurt nursing home patients, they would also severely impact those who receive care at home, often referred to as home and community-based care. According to NPR Radio, Medicaid pays for care at home for roughly 4.5 million Americans. The Medicaid cuts that passed the Energy and Commerce Committee would devastate America's family caregivers, as Medicaid also funds caregiver respite programs and caregiving training. The cuts would hurt our most vulnerable and their families. Where are the citizens where are our citizens? So where do Americans, how do they feel about this? Well, most Americans are opposed to this. Most Americans, including Republicans, are opposed to this.
Right. Well, democracy isn't real.
So nobody voted for this, as Steve Bannon said.
Nobody had this platform.
No, he didn't. Trump ran on not touching Medicaid. In fact, there is support for more spending on Medicaid. People want you to spend more money of the government's. Polling from Kaiser, published in March of this year, found that 42% want to see an increase in Medicaid spending. Just under 3 in 4, so 73% of people polled, say that Medicaid is important to their local communities. 3 out of 4 people. Democrats, 83%, Independents, 74%, and the overwhelming majority of Republicans, 61% of they see Medicaid as very important to their local community. That's the overwhelming majority of Americans. Here's a lady to tell you how it's going to affect rural people.
My name is Alexis. I'm a nurse in Southern California. I'm not a politician. I'm not a CEO. I'm someone who wakes up every day and goes to work caring for the people in my community. And I'm here specifically to speak out because what is happening to our healthcare system, especially in regards to long-term care facilities and rural hospitals, is not just wrong, it is very dangerous. I'll just say it plainly, Medicaid cuts will kill people in specific populations, rural communities, disabled folks, and the elderly. Those cuts hit the hardest.
Wow, just like the COVID.
Yeah, just like COVID.
Gene therapy.
Okay, so we'll see what happens with this. I hope that the Republicans in the Senate will stop it. And I hope the Republicans will convince Trump to go after the Pentagon, which is what most people want them to do, and cut that. But that just shows you who's running the government. The war machine is still running the government. As Trump seeks peace, which is good, he's also wanting to explode the Pentagon budget. The Pentagon budget should be in half. We don't have anybody out there looking to attack us. We don't have anybody. There's no one looking to attack the United States. Nobody. This is all welfare to Raytheon and Booz Allen and Boeing. This is this is welfare to big corporations. That's what the war budget is. And they're not going to cut that because they're the ones who actually control those people. Okay, we'll keep an eye on this, and you should make sure that Trump and the Republicans listen to MAGA and listen to the workers, listen to the overwhelming majority of Americans, listen to Josh Hawley. Okay.
Jimmy, how do you want to respond to this? Rumble Bro says, right now, Jimmy's talking about this Medicaid disaster bill, yet wants universal government health care. Your response?
Yeah, you know why? Because we now pay twice as much as the rest of the world for worse outcomes. So when I say twice as much, I mean you are paying 100% more for your health care than the rest of the world, the rest of the Western world.
Who's his health care? I'd like to know. Where do you get your health care from?
And then when you go to use it, they screw you anyway, and they don't give you your coverage.
I mean,
so this is
are you joking?
This is the worst system in the world that we have. So people are brainwashed because the people who run healthcare and pharma, the health insurance companies and big pharma, they own the TV stations too. They own the newspapers and the news outlets, and so people get brainwashed into thinking that somehow we have a good healthcare system. We have the worst healthcare system in the world.
I'm only for government-run bombing of other people's countries.
That's right. So again, it's not government-run healthcare. Medicare, if your parents, your grandparents are on Medicare, they go to a private doctor in a private hospital, and they go to a private pharmacy, and the government pays the check. And why that's better than the system we have now is because the government person doesn't have a financial incentive to deny you health care. Right now, the private health insurance company has an incentive to deny you health care. The government guy who would be writing that check doesn't. The private health insurance guy who writes that check does. And a third of the money that you spend on health care right off the top is skimmed right off the top and goes to a middleman that we don't need. A third of that money that we spend. So I think we spend like $21 trillion or something like that on healthcare in America. Or a third of that. What's a third of 21?
7?
What's 30% of 21? I don't.
3 times 21 is
3 times 7.
3 times 7 is 21. So
yeah.
3?
So it would be like $7 trillion. Goes right off the top.
How come Elon can't doge private healthcare since it's so intertwined with the government itself as it is?
So
like right now, you do have government-run healthcare, just for the record. The government runs it horribly, and you get the worst of all worlds in one system.
Come see us live in Los Angeles, Buffalo, Toledo, Montreal, Ottawa, Glasgow, Manchester, Belfast, Dublin, London, Liverpool, Birmingham. Go to jimmydore.com for a link for tickets.